after a severe trauma, either mental or emotional or physical trauma. And we hear this a lot from patients that their diabetes has developed shortly after that. So COVID-19 is obviously a severe trauma to the body. And the fact that they develop diabetes shortly after is not surprising. I mean, people with HIV and AIDS, after they've been on antiretrovirals for about 2 years, at least 10% of them develop diabetes. So it seems to be one of those things that is developed after, like I said, a severe trauma or emotional shock, which has triggered the immune system, which is supposed to protect your body, to attack the insulin-producing cells in the pancreas, and with the result, you develop diabetes. So we do have a helpline on our website, Diabetes South Africa. It's 2 S's.org.za, and it's manned by a doctor and a diabetes nurse educator. So if people have questions, they are welcome to phone, and we will try and help them.
Now, Margot, just first of all, explain the difference then between type 1 and type 2 diabetes, because you did mention that type 1 seems to be the one that's more mostly actually triggered by traumatic incidences.
Well, type 1 diabetes is an autoimmune disease. So that means that your immune system attacks the beta cells in the pancreas that produce insulin, and your body is no longer able to produce insulin. Without insulin, your body can't make use of the food that you eat. Then you have to be treated with insulin injections for the rest of your life, up to 6 injections a day. And normally that occurs mostly with younger people under 30, down to babies. And also it can occur in older people, which is a late onset type 1 diabetes. But with type 2, normally we find that the patient has insulin and their body is producing insulin, and sometimes they're producing too much insulin, but that insulin is not working effectively. And the reason can be contributing factors can be because the person is overweight or obese and not perhaps exercising regularly, but there is also a strong genetic factor. So if you've had family members that have diabetes, then you are much more at risk of developing it yourself.
And according to some of the research that has been done, is the trend of the COVID-19 recovered patients who are getting this diabetes, is it consistent across age groups as well as gender?
Yes, I think it is. You know, one of the important things to remember, patients with diabetes, is to try and have your diabetes as well controlled as you possibly can, because this will increase your chances of recovery from COVID-19. People tend to get it more severely if their blood glucose levels are not well controlled. And having said that, you know, it's not an easy thing to control your blood glucose levels. You know, there's so many factors that influence those levels, and you know, people need help and support, and that's what Diabetes South Africa does.
And just on the issue of actually treating diabetes and how it can be managed, just can you share with our viewers what the different ways are that type 1 and type 2 diabetes is actually treated and managed, that it isn't actually a death sentence?
No, not at all. And, you know, this year is the centenary of the discovery of insulin, which has really been a miracle drug. And previously, before the 1920s, people with type 1 diabetes used to die. It was definitely a death sentence. So insulin is really a life-saving drug for people with type 1 diabetes. And once they get into the practice and are supported and helped with their management of diabetes and their understanding how and when to do their insulin injections, they can live a normal, healthy life, and most people do. With type 2 diabetes, you are normally assessed initially and asked to perhaps lose 10% of your body weight, become a bit more active, and this sensitizes your cells to the insulin that you do have. Often people are given treatment of different types of tablets, which will make your body more sensitive to your insulin, or perhaps increase the insulin levels so that your body can bring the blood glucose levels down and use the food that you're eating. And all of those things will help you to control your blood glucose levels. However, like I said, there's so many things that influence those levels, and particularly if you're ill or have any kind of infection, increases your blood glucose levels, which can affect people that develop COVID-19, because obviously your body is going to try and fight that infection and push your glucose levels up to help your body to fight it. And then it becomes a bit of a vicious circle, because your blood glucose levels are going higher, which makes it difficult to control them, and the healing takes place better when your blood glucose levels are at a normal level. But to bring them down, you have to be able to solve the problem that's causing the infection. So it can be very challenging when somebody is ill to manage those glucose levels. And also, there's so many other things like heat or cold, how active you are, what type of food you're eating, stress increases or decreases your glucose levels. So, there's about 10 or 15 different things that can influence your blood glucose levels. So when people say, oh, your blood glucose levels are uncontrolled, we don't know what's going on in that person's life that can be contributing to the fact that they're uncontrolled. It's we tend to get a lot of judgment when we're diabetes. It's your own fault. Oh, your lifestyle is wrong. It's a lifestyle.
And sometimes, like you mentioned, Margaret, it actually is a predisposition, due to genetics. And for people who don't really know whether there is a family history of diabetes, just lastly, how frequently should one be going for screenings?
And I would think once a year, if you have a genetic history, someone in your family with diabetes, I would definitely say to go once a year, and also to be aware of the signs and symptoms, so that if you display any of those symptoms, 2 or 3 of them, then I would go and get tested as well.
Thank you so much for your time this afternoon. That was Margot McCumisky, who is the National Manager of Diabetes South Africa.